Okay, I'm here with Miss Cox. She's a patient of mine who has had some great results, and I just want her to tell her story. So, Miss Cox, tell us about yourself.
Um, well, I came to Atlanta last year from a hospital. It was my fourth hospitalization. I struggle with major mental illness, depression, suicidal thoughts, and attempts. And when I got pregnant, all of that literally went away. I had no symptoms of depression. I had no symptoms of BPD. I was tested and they said I don't have depression. And my mom looked into it and found out that progesterone can act as a mood stabilizer. She found out about Dr. Taylor and we contacted him. After I had my baby and started taking progesterone in the midst of postpartum depression, it literally went away. When I started taking progesterone, I felt like a normal person. I felt like I didn't even have mental illness, and I felt like I was actually functioning without the help of 50 different antipsychotics. And it's literally saved my life, and it's stopped anxiety attacks mid anxiety attack. Like it's like a miracle drug.
So, how are you taking the progesterone now?
Now I take it, I get pellets inserted. I was on the pills, but I personally think the pellets are easier. You don't have to remember to take them. And for somebody who's been on pills their whole life, it really makes you feel like a normal person. You don't feel like you have to swallow a bunch of pills every day to live. You wake up and you're okay. And it's one of the best feelings ever, honestly.
Yeah, and especially, and Ms. Cox, I'm not saying anything derogatory, but younger people, it's harder for them to get them to do something every day. It's harder for older people to get them to do something every day. Also, you're using some of our Taylor MD formulation supplements that kind of help you also. Is that correct?
Yes, I take what do I take?
Easy Calm?
Yeah, I take the Easy Calm and the L-theanine.
Yeah.
And the Easy Calm is a big help too. If I start feeling uptight or irritable, I can take one or two and be completely okay within 10 minutes for the rest of the entire day. It stops anger, it stops anxiety. It's like a miracle. I don't know how it works like that, but it does.
And tell me about the program that you're starting where all of these issues had caused you to interrupt your education before. So tell us about this program that you're starting.
The program I'm about to be going to, it teaches you life skills, teaches you how to be independent, and helps you get your GED if you don't have one, sets you up with a paid apprenticeship, partnering with Coca-Cola and Ronstadt. And without progesterone, I would not be able to do it because I would be on so many medications. And when I was on all the medications, it was holding me back. But progesterone is the first thing that's helped anxiety, depression, BPD, and ADHD at the same time. One pill helped everything.
Wow. I am so happy for you, Ms. Cox. You're about the age of my daughter, and I know your mom, and I know how badly she wanted you to be helped, and I know that's how I would feel if you were my daughter. So I'm so happy for you. I'm so happy for your mom, and I can't wait to hear about all of your future success. So thank you so much for doing this testimonial for us, and thanks again.
Thank you.
All right, bye-bye.